So you're probably wondering why this slide is up on the screen. It's the Christmas holiday season, and in all likelihood, some point over the next few weeks, if you're flipping through the channels, you're likely to see a replay of this classic holiday film. And the basic premise of it is, and sort of what this scene depicted, was the Jimmy Stewart character feeling that his life had amounted to nothing, and it just wasn't worth anything until his guardian angel appeared and helped walk him through an imaginary journey of what the world would look like if he had never been born. So in that same spirit, as we began to think about what kind of research we wanted to do in conjunction with this 50th anniversary year, we thought it would be really valuable to take a look at what would health and retirement security look like if there weren't an employer-sponsored system at all. And the result of this is a report that is going to come out early next year in its full form. What you have here, and I encourage you to pick up a copy of this as well, is merely a summary of it. And what we want to do today, we just have about 15 minutes, just give you all a sneak preview of some of the interesting findings and the themes of this report that I think will be very illuminating. We sought to ask and answer 3 questions. First, what sets the U.S. benefits system apart from other nations? What are the unique values that define the strength of the U.S. system? What would health and retirement security look like without employer-sponsored benefits? The It's a Wonderful Life question. And we chose to do this in 2 ways. One, by assembling all in one place, in one report, the very best possible data and existing studies that are out there. And we relied upon our admired colleague, Sil Schieber, and a number of other folks to help us with that. And then also to work in conjunction with the Employee Benefit Research Institute in conducting some new research that examines these questions. So on the first question, what makes this exceptional benefits system? First of all, that the employer-sponsored system helps us lower the payroll tax burden for both employers and employees to support the public programs that we have as compared to other nations in the world. Employer-sponsored benefits bridge the gap between both individual and government-run programs, and that far from being a drag on the economy, benefits are really an integral part of facilitating economic growth and job creation, and with fully $20 trillion worth of financial assets in the system. This chart sort of represents the first point that I was making about the payroll tax burden. That lowest bar on the left-hand side is how employer-sponsored plans enable our payroll taxes to be lower than other Western industrialized countries, members of the Organization of Economic Cooperation and Development. Again, more information in the report. How do employer plans bridge the gap? Well, you can see those up on the screen, bringing together large risk management pools and creating economies of scale, utilizing behavioral tools, avoiding a one-size-fits-all approach, improving efficiency of labor markets, creating incentives for employers to act as effective agents, et cetera, et cetera. All of these things are things that you know intuitively because of the work that you do. In this report, what we've done is bring together data and analysis to support each of those points. And that brings us to this last penultimate question of what would health and retirement security look like without employer-sponsored benefits. We worked with EBRI, Paul Fronston, Jack Vanderhei, did some very valuable simulations, and the result of that is that without you all and what you do, it would not be such a wonderful life for Americans in terms of their health and retirement security. So that's a real tip of the hat to you all. And to explain that further, are 2 of our members of our board of directors, Peter Baxter from the National Rural Electric Cooperative Association, and Melissa Kahn from State Street Global Advisors. And so I'll turn it first to Peter and then to Melissa.
All right, thanks, Jim. You may be wondering why Melissa and I got the opportunity to visit with you all for just a minute here to cover some of the slides. I sort of put it in the category of no good deed goes unpunished. I think it was Melissa and myself at a meeting earlier this year suggested, hey, if ABC is going to do some research, why not partner with an organization here in town that we have good relationships with, but is really in that business, which is the Employee Benefit Research Institute. So I guess
now we're punished.
Now we're punished, right? That was the idea. Okay, so I guess a little bit of context, and I don't know, Melissa, how you felt, but I felt like Speaker Ryan, first thing this morning, sort of stole our thunder in terms of talking about some of the statistics, but I think that's actually great news that he gets it, right? Those numbers were sort of rolling off his tongue, off the top of his head. So he said 177 million Americans. This number is 178. What struck me really about this data here was that the employer sponsorship and providing access to health care for employees through the employer-sponsored system is just about double the total participation from both Medicare and Medicaid combined, right? So obviously, the employer sponsorship and the opportunity for access dominates the marketplace. And there's lots of talk about tax expenditure, and healthcare, is at the top of that short list of 5 things in every conversation. But for every $1 of benefit under the tax expenditure, employers are actually spending, almost 5 times that in terms of the cost of funding these benefits, right? So it's obviously important to the employees. It's important from a competition and productivity standpoint for employers, but it's also important for the economy. So Jim mentioned this sort of innovative idea of what would the world look like without employer sponsorship of employee benefits. So I work in both the healthcare and the retirement space, but just looking at the healthcare space, based on the modeling that EBRI did, right? So looking at behaviors in 2013 before the individual mandate came in, imagine a world without employer sponsorship of healthcare. Imagine 113 million Americans either not being able to afford healthcare or choosing not to purchase healthcare. By way of comparison, when CBO looked at the impact of eliminating the individual mandate, which we could see within hours actually happening, they, I think, projecting out to 2026, I'm going off the top of my head, but a number of something like 13 million Americans, right? So obviously that's a huge impact, but it pales in comparison to what life would be like if we didn't have the employer-sponsored system. And then finally, the value of what is actually being delivered through the employer system. If you look at the percentage of the cost of reported claims in healthcare, employers cover about 83% of that cost, whereas individuals that are purchasing healthcare through other means individually or non-group plans only covers about 60% of that. And out-of-pocket expenses, if you're going out and looking for family coverage, if you're getting it through your employer, right, you're averaging about $1,700, $1,800. If you're going out in the individual market, that's over $4,000. So pretty dramatic differences there. And then I guess the final point is around innovation. And yesterday we had a little discussion around the importance of innovation and how employers are actually driving innovation in the healthcare space. And that's a message we need to get out to Congress and help policymakers understand better. But a study by the Rand Corporation suggested that wellness programs, which have been around for a long time, but I think today we would say they've sort of finally grown up. They project that they're producing ROI up to six times the value of the investment to set them up and run them. So that's a pretty staggering number, and obviously has an impact on not only absenteeism but presenteeism in the workforce. So all of this translates, hopefully, in terms of more money in people's pockets. That's something that's very important to me and my firm. I know it's something that's also very important to my good friend Melissa Kahn. So let me turn this over to Melissa, and she'll bring us home.
So thanks, Peter. Before I talk about retirement, I just want to add my thanks and also appreciation for everything that the American Benefits Council does, and to also celebrate your 50th anniversary with you. And I just want to tell you that I will not be here for the next 50 years to help you out, so just let you know that. As Peter was saying, you know, the fact that we have these health care plans through our employers gives people more money, and that money can go into their retirement plans, which is really great. So, you know, there's a lot of debate over the years about coverage and access. And depending on how you cut those demographics, you know, people argue about it. But I think that our system has done a really great job over time of covering the civilian workforce, and I think these statistics show that in terms of 80% of full-time workers do have access, and 65% actually participate. But what I think is more staggering, to build on what Peter was saying just before, is the cost effectiveness of our system. So for every dollar of tax revenue that's spent, or tax expenditure that's spent on retirement benefits, we get $7 going into retirees' pockets, and that's pretty powerful. So in conjunction with EBRI, EBRI's done some fabulous work, and I know I saw Dallas earlier. I don't know if he's still here, or anybody else from EBRI, but we all rely on EBRI and their great work for what we do. It really helps us as a non-advocacy organization. So among the different things that they do, they have a retirement readiness ratings, and that simulates the proportion of households that will have adequate resources in retirement. One of the stunning findings that they had in this research is, you know, we hear all the time about the tax expenditures really benefiting mostly highly paid, and so we need to flip sort of the system on its head. But what they have found is actually the segment, the cohort that really benefits the most from these tax expenditures is the middle income, the lower middle income. And that there's a 50% increase among those households in terms of having adequate retirement resources. So we think that's pretty powerful. Lastly, and I know we at State Street Global Advisors use this figure a lot also in work we've been doing, is this retirement savings gap of over $4 trillion. And again, when they're researching what would happen if employer-sponsored plans weren't there to fill the gap, that would increase to over $7 trillion. So it's pretty powerful, the resources that we as employers bring to employees, to individuals, pretty powerful. So conclusions. I think, you know, and what Peter said, you know, I was watching the speaker tape this morning, I'm going, okay, really? Do I have anything to say now? He said it all. But really, I think the points that come out of this is that employer plans really do maximize coverage while minimizing the burdens on taxpayers, on federal entitlement programs, on everything. They play such an important role, and I think that we get a huge bang for our dollar, our tax dollar, through employer-sponsored plans. And not only that, as the last panel was saying, and as yesterday we heard at the board meeting, employers are the engine of innovation in this space. I mean, just listening to this last panel, you can see the thinking that goes on, the creativity that goes on, and really trying to meet our employees' needs, not just in retirement, but all throughout their working lives. And I just would say, as sort of the conclusion here, that public policy needs to continue to promote the development of all of our employee benefits, health, retirement, and everything, even Puppy Tuesdays, whatever. So thank you. We are not taking questions.